Hello, my name's Natalie Logue, and I come to you today from Bremerton, Washington. I'm a student in the Health Systems Leadership Program through Gonzaga here, and I'm excited to share some of my background and experiences with you guys today as we go forward. So, first off, I graduated with my Bachelor's of Science degree from Washington State University in 2008. I had experience prior to that working in long-term care during nursing school and a little bit before as a CNA and then also as a nurse tech. When I first got out of school, I worked long-term care briefly, and then I transitioned to a completely different realm of nursing, which was surgical nursing. I worked at Harborview Medical Center for 6 years in Seattle, and 3 of those I was an assistant nurse manager. So yeah, working at a level 1 trauma center was an experience that was invaluable to me. I'll be grateful for forever. It just teaches you so much so quick about healthcare and your ethics and principles about life. So I'll go a little bit more about what I do now. So currently I am here in Bremerton at Harrison Medical Center as an administrative coordinator for the hospital. So mainly I'm kind of like what your house supervisor would be at other facilities. So I really like that new position, and it's helping me expand my leadership role. So that's great. So let's see, let's start with some of my ethics and policy, legal perspectives, what we're supposed to cover in this video. So I was on the leadership team at Harborview for about 3 years, and being on that team, I was exposed to quite a few scenarios that needed some expertise, analysis, and ethics committee review and such. So I had a great deal of opportunity to get familiar with ethics and kind of what the main things that come up are when we're talking about this. So of course in a surgical setting you're going to be talking about informed consents and end-of-life care at a trauma center, things like this. So I'll start with my main ethical concern I'll talk about here was with informed consent. So essentially you're supposed to have consent from an individual who has not been medicated, who's able to consent themselves, who understands the procedure and the like. But more often than not, I'd hate to say it, but the patients are medicated when they're consented, or they do not have a clear understanding of the procedure when you go in for your preoperative interview. So that became an issue several times severely while I was at Harborview. And so I'd like to learn more about the legality and principles in this class, and how policies and those kind of things can hold up in the court of law. So there's also issues now in my current position. One of the biggest things that comes up is durable powers of attorney and end-of-life situations. So who makes decisions in the end-of-life care? If they don't have somebody to do that, who is it up to decide that this patient gets what? Or what if you don't have enough time? So the care providers are then forced to make decisions that might not be in the patient's best interest. So there's a lot of these principles that I'd like to review in this class. I'm excited to be here, learn more about ethics, really dive in with you guys and, get into this. So another one that is one of my favorite things to talk about is physician disclosures. So when I had to do a presentation at a conference last year, and you had to fill out all of this documentation stating what your disclosures were and this kind of thing. And of course, being a nurse, I didn't have any, so I kind of wondered about this. But it turns out, the physicians are getting profits for using and researching devices for surgery, medications that are being used, and we're not sure if that should be the right one used. I would really suggest you guys as healthcare professionals look into this more, because this is an area I find of concern as a healthcare provider is, are we really doing the best thing for the patient, or is it a self-driven profit scheme here? It's scary to think about, but healthcare is essentially another type of business. But we don't want it to be that way as nurses, of course. We want to be able to give the best care and do the right thing for the patient all the time, which I hope to be an advocate for as a nursing leader in the future. It's great to meet everybody, and I wish you the best in this course. Take care.